Thank you for being with us. I'm Jacob Ward with NBC News. With Black Friday and Cyber Monday now behind us, today is Giving Tuesday. Now, since 2012, the Giving Tuesday movement has been an opportunity for everybody to pay it forward, whether it's a friend or a loved one or a charity of our choice. And Giving Tuesday this year might be more important than ever. As we know, 2020 has been a year of terrible challenges. It has forced families and communities and businesses to adapt to life amidst a pandemic. So in honor of Giving Tuesday this year, NBC News has brought together the leaders of several charitable organizations across the country to discuss their roles throughout this crisis and how they have been able to innovate and adapt to reach those in need. Let me introduce our three panelists. Asha Curran is the CEO and co-founder of Giving Tuesday, a global generosity movement promoting philanthropy and acts of kindness. Art Delacruz is the president and COO of Team Rubicon, a nonprofit disaster response organization that utilizes the skills of military veterans. And Dr. Harold Koplowitz is the president of the Child Mind Institute, which is an independent national nonprofit dedicated to transforming the lives of children and families struggling with mental health and learning disorders. So I'm going to begin with Asha. Your organization is the namesake of this event that we are honoring here. And so I want to start exactly, with a good description of what your organization is. Tell us about Giving Tuesday and what type of work you do.
Sure. So Giving Tuesday, as you said, was founded in 2012 on the basic idea that everyone everywhere has something to give, that every act of generosity is meaningful and worthy. And makes the world a better place. And it has grown over the years into a gigantic global movement, which is really active year round in inspiring generosity. We have 75 official country movements, each with a leader and hundreds of local communities, and then additional hundreds of cause or identity-based coalitions. So Giving Tuesday is really about collaboration. It's really about creativity. It's really about the difference that every individual has the capacity to make. And the really remarkable thing is that all of those leaders are very connected with one another. So they're constantly sharing ideas and innovations and anything they can to help each other. So our Giving Tuesday leadership community right now is just bursting with inspiring ideas and photos. And as you alluded to, generosity right now is just absolutely fundamental to the world that we are going to be able to rebuild together.
All right, let's talk about Team Rubicon. Your organization describes itself as the only nonprofit disaster response organization that utilizes the skills of military veterans. Tell us how that works. What type of work do you do?
Well, if you can imagine, military veterans bring a wealth of experience from their time in uniform. And what it allows us to do is to go into communities to help them prepare, respond, and recover after natural disasters or humanitarian crises. As you mentioned at the start, 2020 has been an absolutely devastating year, coast to coast, and around the world, in particular with natural disasters, coupled with the pandemic. So our military veterans, first responders, and civilians, they're trained and equipped to be able to deploy into these communities and serve even in the pandemic. And 2020 has been particularly challenging because we found that disasters, which we generally define as events that overwhelm a local community, because of the pandemic, it's expanded our mission set to include things like medical services or medical testing, feeding insecurity, in addition to responding to, a record hurricane year and a record fire year. So our military veterans, have found a way to put the uniform back on. And I think similar to what Asha has talked about is, how do you find through giving and collaboration and generosity a way to help communities across the country on their worst day.
Hmm. And Dr. Koplowitz, Harold, your organization works on, effective clinical care for children and adolescents. I have to assume that 2020 has been a similarly transformative year for you. As you were going into this year, what did you think you'd be doing and what are you doing now?
So I think that in a good day in America, pre-COVID, we have an epidemic of mental health disorders in our children and our adolescents. And it's amazing to me how often we kind of ignore it. So we have 200,000 kids with diabetes, and we have 15,000 kids every year with cancer, and another 7 million with asthma and 7 million with peanut allergies. But we have 17 million kids with a mental health disorder under the age of 18. So that means that everyone knows and loves one of these kids. So it was not a good time in the respect that only 40% of that 17 million got some help. And since the pandemic hit, I would tell you that every child in America's mental health is at risk. Not everyone will get a mental health disorder. Some of them will get significant symptoms that will interfere with their functioning. But it literally on March 15th, the place had to turn upside down, so that we went from closing our doors in both San Francisco and in New York, and we went to remote. And amazingly, 98% of the patients in 48 hours continued their treatment online. What took us a while, though, was that it took months before I think America started to adapt to telemental health. And today we're seeing more kids than ever before. And I could tell you that I didn't think we would be a telehealth product. And I didn't think also that we could be in 250 schools across America doing virtual trainings. In New York City alone, we are providing digital wellness kits to 1.1 million students and webinars to 75,000 teachers, giving them more tools in their toolbox on how to handle kids' anxiety reactions and behavioral management difficulties that happen in person and also online. So 2020 has been an extraordinarily challenging and stressful year, I think, for every human being, but particularly for kids. And when I say kids, it's really 18. And for some of us, when we really think about adolescence, we think it's 24. Remember, Hertz doesn't let you rent a car until you're 25. So we still are dealing with a lot of risky time. It's a risky time, and now it's become even riskier.
Asha, Harold was talking there about how he had to pivot, right? I mean, for you, I think COVID has been a shock on so many levels. We already needed a Giving Tuesday, given so many people's hardships even before the pandemic. Let's talk about COVID in particular. How did it change your organization, and how has it changed the landscape of philanthropy more broadly?
Yeah, we did have to pivot and adapt. The thing that I find really inspiring is that exactly what Harold is referring to is happening all over the place, with organizations really pivoting to meet their mission in incredibly creative and innovative ways, and really rapidly. So that's been actually amazing to see, because the nonprofit sector is a wonderful thing, but I don't think anybody often accuses it of being rapidly innovative and pivoting to meet the moment. So that's been really wonderful to see. From our perspective, what happened was that when the pandemic hit in March, we immediately started to receive, requests from around the world. What was going to be our response to this moment? And so we did a few different things. We set up a special Giving Tuesday in May, which we called Giving Tuesday Now. We've never done anything like that before. Giving Tuesday's never been something that we just stand up a Giving Tuesday every time there's a disaster. But this had a very, very particular collective and universal feeling to it, obviously, just as generosity is also collective and universal. And that day was wonderful. It led to a huge spike in donations, but also just a real sense of civic engagement and civic participation, and neighbors caring for neighbors. And I think we've seen that throughout this entire period of time. The other thing we did was to start a special program for people who are making a difference in their communities at a very grassroots level. We call it the Starling Collective, because I think one thing that we've seen during this pandemic is nonprofits are doing amazing things and obviously meeting incredible need, but so are just regular citizens. And that was always true, but I don't think I've ever seen it in quite as intense a way as I have during this period of time. People setting up mutual aid networks, people setting up mask sewing collectives, right? Really utilizing technology to spread these wonderful ideas. I don't know if Art knows, but we actually have a Giving Tuesday military sub-movement that was started by 4 military spouses, and their goal is to inspire non-monetary acts of kindness on military bases all over the world. So I think that kind of just citizen action that we've seen is something that we've really tried to support with using just our own resource money that we are obviously not spending on travel and convenings and things like that.
Right. Asha, I think about the moment we are in, and I would consider you and the three of you, to be uniquely placed to tell us a little bit about how difficult this moment is, right? And I wonder if you could take a second and try to help us put in perspective how deep the need is for effective philanthropy right now? What's your sense of the landscape of need at the moment?
Yeah, I think this works both ways, right? What I'm seeing is that the need has never been greater, but also the generosity has never been greater. At the same time, the generosity is very, very great. The question is it enough? Because the need is so great, right? So I think that not the nonprofit economy is hurting. I think that on the one hand, you're seeing, as I said, incredible pivots, creativity, most importantly, collaboration, because I think it's never been clearer that we're never going to get through this except for together. And that's true at an individual level and at an organizational level. At the same time, I think that we really need to see, multiple sectors stepping in to help, because as much individual giving as there is, right? And last year on Giving Tuesday, $2 billion was donated in a 24-hour period. The fact is that this year we're in a very different place, and the need at an organizational level is so great, right? These are the organizations that are keeping people fed and sheltered, and more than that, bringing music and art and joy into people's living rooms when they are socially isolated and sometimes despondent and experiencing all sorts of mental health crises. And that kind of action is equally important. And at the individual level, I think we need to be more aware than ever of what our neighbors need, of the importance of connection, of the importance of companionship, and of reaching out, and of making sure that people are not isolated. So the need is very, very great. This is an unbelievably challenging time, and I think that what I'm focusing on Giving Tuesday is the opportunity we have to rebuild in a way that prioritizes generosity as the foundational value that we rebuild upon.
Art, I think of Team Rubicon as, I associate with missions to Haiti, missions to foreign destinations, places abroad that need American help. But I also see right now a tremendous amount of need here in the United States. And I wonder if that has been a transition for your organization, thinking about helping here at home in addition to being abroad.
Yeah, it's really, really interesting you mentioned that, because our roots actually did start in Haiti in 2010. But one of the things we've figured out over the time is that the United States has an incredible need for people to help with disaster response. So the organization is essentially pivoted, where the bulk of our operations are done domestically. This year with COVID has been particularly impactful for our organization. We've done 370 operations this year, and as an example, last year there were 101. But what's interesting about it is the bulk of these operations, 327 of them, are related to COVID. It's things like partnering with Feeding America to help, solve or make a dent in this problem of food insecurity, or health and medicine in places like the Navajo Nation, where we've augmented their medical providers, or helped in places like Santa Clara. These were all missions that we didn't necessarily envision when we made that pivot in March. So one of the things that we found that has been really amazing about our volunteers, and amazing in particular for the people that have donated to Team Rubicon, is we've been able to build this toolbox of incredible skills in the men and women who volunteer with us. And come March 12th, when we made the decision to pivot into COVID, we were able to disassemble a lot of the processes and the technology and the procedures that we had, and reassemble them in a manner where we could answer the nation's call for COVID. So, a lot of the things that we've done in disaster response, be it domestic or international, directly translated to managing the logistics with food, or managing the logistics with testing operations in Los Angeles, or managing, volunteers and personnel in a chaotic and ambiguous environment. We had men and women who'd taken off their uniforms, and that was familiar to them. The one thing I think, and I share this, in common with, I think, everyone on this panel, is this commitment to collaborate, to understand how we can have the most impact possible, and our real reliance on the ability of donors across the country to help in those times of need. To that question about the challenges of fundraising, one of the things we found in 2020 that is very unique is it's just been a chaotic year in the news cycle, from a contentious election to a pandemic to this natural disaster cycle that has just been absolutely, unheard of, we found that, we generate a lot of revenue or donations via the news cycle. And when things like Hurricane Laura or Sally or these 12 storms, that made landfall this year, they'll pop in the news cycle and be gone. And what that creates is what we call low attention disasters and people and communities that are under-resourced for the natural disasters that have struck them. So it has created a very, very challenging, fundraising environment, but the need has not dissipated at all.
And Art, help me understand, what is it about the psychology and the training of military veterans that you think makes them especially effective in the role that you've purposed them for? I mean, if I point at an Air Force veteran, a Navy veteran, a Marine veteran, and pull them off the street and into a needful situation, what is it in that person that you think predisposes them for doing it well?
I think it starts with the fact that all of them, have raised their hand and volunteered to serve in the military. We have this short hashtag. We like to say, our volunteers are built to serve, and they demonstrated that in their initial, commitment to serve in the military. Once they get in the military, you begin to learn these skills that are really, really beneficial in a disaster environment. From day one of boot camp or onboarding, you begin to understand, that you're a member of a team, that everyone has a role and they have to perform that role. You understand the importance of, risk mitigation and understanding process and procedures and being skilled in using those tools. So that training, starts at that point. So now you have a disposition for someone who wants to serve. You have a unique skill and education from the military. And then what's really wonderful about it is once they take off their uniform, those muscles continue to be there and they continue to serve and they continue to have impact. One of the things we like to say, and our chief medical officer who continues to serve had said this, is, you can't view military veterans as transitioning, right? They don't separate from the military. They're actually graduating from the military. So they have these unique experiences and skills. You can imagine someone like our CEO who served in Iraq and Afghanistan. How did that translate in Haiti? Or how does it translate for our team that we have in Honduras today, serving communities impacted by those hurricanes? You can look at that chaotic environment. You can make the best decision you can in the absence of, complete clarity and move forward towards that objective of having a virtuous outcome for the people who need our help.
Yeah. Harold, when I think about CMI, I have to say that I am intimidated by what you must have to do in trying to articulate the need. I feel like all of us, I'm a parent of 2 young daughters, right? All of us who have children or are connected to children understand that there is something going wrong here, that it's something very difficult in the sort of psychological landscape for kids. How do you help people understand the need and how deeply kids are being affected right now?
So I can tell you that typically we've had a very robust public awareness campaign. We think, unlike many other illnesses, we have to keep educating America because pre-COVID, it would take 2 years from the onset of symptoms before a parent would reach out to get some help for their child when they suffered from something as simple as a learning disorder, having difficulty to read, to something as complex and as serious as a child who won't go to school or a child who's actually losing touch with reality. So our public awareness campaign structure was there. And typically we run a campaign in May called hashtag my younger self. And we get famous people to give us a 1 or 2 minute video telling us how they struggled with a mental health or a learning disorder and they got through the tunnel. It's very hopeful. So you got Emma Stone talking about her anxiety, or you have Governor Newsom talking about his dyslexia. This past year, we decided that it became too global, that every parent had to be involved in this kind of awareness. And we switched to hashtag we thrive inside, that while we're inside our houses, we still have to thrive inside our head. And if we could get examples of famous, influential individuals who could tell us how they're thriving, whether it's reading a book or taking a walk or doing 10 jumping jacks every day or talking to their mother, that would give them permission for parents to go and get really important information. And overnight, we started doing Facebook Lives in Spanish and in English and reaching millions of people, which is, again, wasn't the mission originally, but we reached 275 million people with hashtag We Thrive Inside, but literally twice a day started doing Facebook Lives for parenting during COVID, whether it's distance learning, whether it's how do you break up the time for your kids, do it a week at a time, Wednesday's pizza night. Let's not talk about how many days we'll be out of school. Let's just live in the here and now, teaching parents how to do mindfulness. But the interesting part is the challenge to raising funds when you traditionally did lunches and dinners and those kinds of fundraisers. All of a sudden, everything is virtual. And I think the opportunities are great for reaching more people, but at the same time, very challenging to keep your budget balanced so that you can do the work you do. Not-for-profits, my late father-in-law used to say, it's amazing, you do more and more important work and you make less and less money. I said, that's a special gift we have in the not-for-profit world, how we try to figure out how to do more with less. But the challenge this year is particularly bad because I think we're halfway through this marathon. I think we have another 8 months. And I worry a lot about kids who were just barely holding on to staying in school beforehand. And once they let go, how terrible it is to ever get them back in school and get them back on the road. And when you talk about kids who are anxious and who are socially uncomfortable, and once we send them back to school, how they're going to become more symptomatic. So we have that's the next wave. Once COVID, we have a vaccine and COVID is in our rear view mirror, we are going to have to deal with the fact that our youngest citizens are going to be affected by the post-COVID effects on their mental health.
Let's talk about that a little bit more. I was going to ask you, I'd read something from CMI that typically symptoms peak about a year after a major crisis. And at this point, we are 8 months in, 9 months in? I mean, we're not even at a year yet. So what will it look like? How will we know, what signs should we be looking for in kids, a year after the pandemic?
So I think first and foremost, the majority of kids, let's say 60% will be okay. It's amazing. They have a veneer, they have a shellac, they have a resilience. It's kind of amazing how they bounce. But that leaves 40% of the kids who will have either an acute stress reaction a month after this ends, where they will have trouble going to sleep. They'll have trouble with their appetite. They'll have trouble with their concentration. You will have a smaller percentage that will actually have PTSD, that they will, a smell, an idea, a thought, a visual will trigger them. But the problem that we have right now is that this is a chronic event. I was around for 9/11. That was a sprint. We were able to, we knew that the kids who were closest to the World Trade Center suffered the most. The kids who lost a parent or knew someone who died suffered also, and we could track that. This has gone on for 8 months, will mostly go on for another 8 months. This is more like a worldwide depression. And the effect it has on kids, chronic stress is always worse. And so, but we still go back to basics: sleep, appetite, attention, the ability to have fun, the joy of playing Monopoly if you can't still do Little League, the joy of doing exercise with a group of friends on a Zoom call instead of, going to a spin class. But so we have to watch for those things. And I think it's very hard for parents who are under stress themselves. Parents have more financial stress today. They're more worried about their health. I mean, that every time you go on a plane, the flight attendant says to you, put on the mask if the oxygen level drops on your child before yourself. It seems empirically wrong. How could I ignore my child? But you have to take care of yourself. And the other big message that we keep stressing to parents is self-care. Make sure you're sleeping enough. Make sure you're being spiritual. Make sure you're doing some physical exercise every day for 20 minutes. Make sure that you're eating somewhat normally. And speaking to what Art talked about, the news, we tell parents all the time, 30 minutes, I'm sorry, I'm doing this on a cable, 30 minutes max of cable news in 10-minute bites. That's all you need. And because frankly, there's so much bad news at times. I mean, the racial injustice, which we didn't mention, which has just exploded, has had a terrible effect on kids because it means that it's now a new discussion that has to be addressed, again, not with one chat, but an ongoing dialogue. So I feel for American parents right now. I think American parents who are working and taking care of their kids now are tutoring their kids, are now their playmates, are now having to have discussions with them about very challenging topics amid unfortunately, a very politically charged time where I thought we would be quieter now once the election's over. And there's still this divisiveness, which again is very bad for children and makes the role of parents so much harder, which then makes Child Mind Institute more essential to be that parenting resource, that authoritative voice that you can count on, that doesn't take money from pharma or from guns or from liquor or tobacco, that is giving you scientifically sound information that you can be sure doesn't have a secret agenda.
So last sort of round of questions, I'm going to put the same one to each of you, and Asha, I'm going to make you do it first. But if you had either a wish for either a thing that your organization could achieve in the coming year, right, as we in theory kind of come off of this pandemic and into this post-pandemic phase, or something you would wish for society at large. I think about the endurance that we're going to need in terms of our charitable instincts, right? That it's not just a 9/11 type situation where you do it once and it's done. We're going to need to really transform certainly our country and many other countries in order to get past this. So, if you had a wish, Asha, for the next 12 months, either for your organization or for society at large, what would it be?
My wish would certainly be for society at large. I would wish and hope that we begin to think about generosity in a much more radical way than we do now. By which I mean, radical generosity is viewing the suffering of others as being as intolerable as that of your own or your loved ones. If we truly adopted that as a driving value, I think the world would look very, very different. If we had done that before, I don't think it would be looking like it does now. And I would hope that by the time the next pandemic comes around, we will have adopted that mindset more and be in a much more resilient place.
Art, what about you? What would you hope for, either in what you can do or in what you hope society can do in the coming year?
Gosh, I guess I'd start with kind of that societal piece. This is, a national crisis. And in order to answer a national crisis, I think we have to come together, as a nation, as citizens, to make sure we're doing the right things, to collectively and with a mutual understanding that we have obligations as citizens to make sure the nation heals. We've got a vaccination campaign that is coming up, and we're going to have to help the nation get back on its feet by vaccinating people and making our communities more resilient. And it really comes down to, I think, what Asha started with, which is this concept of, neighbors simply helping neighbors. One of the things we see consistently after disasters is people treat each other in that disaster scenario with mutual respect and with empathy and with compassion. And we need to duplicate that for the next 8 months to get through this. So from a societal value, I just simply hope we'll come together and have impact. For our organization, Team Rubicon, my hope is that, we'll be able to find the unique skills and attributes that these different organizations have across the country, these nonprofits and these government organizations and for-profit organizations, again, through that idea of mutuality, where we can come together, find out what specific skills we have that'll contribute to this whole of nation response, and then fund those appropriately. The reality is, nonprofits are not just not for profit. They're really about having a positive outcome and impact. And that takes resourcing from people with the ability to invest and donate. For Giving Tuesday or today is particularly important. If people can give $1, they can give an hour, they can give their time. All of that coming together has incredible impact collectively in moving the nation forward.
Harold, what would you hope for in the coming year, either for your organization or for society at large?
Well, I think I'm dangerously optimistic. So I actually think America has in its DNA philanthropy and generosity. I think that we do help our neighbors. I think we're fighting now and there's division, but at the end of the day, America is known for being the most generous nation in the world. And this is a time where no matter how tired we are and no matter how much COVID fatigue we have, we're only halfway through the marathon, and I'm hoping that as a society, we can get a second wind and get through this with kindness. What I hope for the Child Mind Institute is that I would hope that this kind of crisis highlights how important mental health is, particularly for our children and for our teenagers, and that we don't forget about it once COVID is gone, that we recognize that mental health is as important as physical health, and in some ways maybe even more important, because if you're not feeling resilient, if you're not feeling well, you're not going to get the vaccination, you're not going to take care of yourself, you're not going to shelter in place. So, I know that everyone knows and loves a child with a mental health disorder. It's time for us to not be ashamed of them and to say they are our kids and that they deserve as much respect and as much robust research, but also as much care as kids who have other diseases.
Well, I want to thank my panelists today, Giving Tuesday CEO Asha Curran, Team Rubicon President Art De La Cruz, and President of the Child Mind Institute, Dr. Harold Komplowitz. Now, before we go, we want to show you another charitable organization fulfilling two crucial needs right now. They are feeding families and communities impacted by COVID and keeping small businesses alive. Here is CEO of World Central Kitchen, Nate Mook.
Our core tenet, I think, of the work is adaptation. We always have to adapt because you never know what a disaster is going to bring. But in the process, we started to look at if we were going to deploy big in the United States, what does that look like? We knew this virus wasn't just going to target the big cities. It was going to be in small towns all across the country. How do we do this? How do we reach all these places? How do we mobilize an industry?
Meals at the bottom. They're coming for meals.
So as we started to look at what was going on, we realized that we could activate the restaurants, the local restaurants in the communities who were already suffering, and pay them to produce meals for their community. And that really drove our COVID pandemic response moving forward. We started small with a few restaurants in Washington, D.C., where we're headquartered, but very quickly scaled up to thousands of restaurants across the country that were producing hundreds of thousands of meals per day in big cities like New York, but all the way down to small towns all across America.
Now, that story is part of the NBC News series Visionaries, which profiles innovators and changemakers across industries and what they are doing to make a difference. You can watch the full video at nbcnews.com/business. Thank you for tuning in today. I am Jacob Ward with NBC News.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.